Hi, I'm back. So I've now got the trolley next to the patient. I'm going to make sure that privacy and dignity is maintained by closing the curtains and telling the examiner I've done that. I'm now just going to recheck for consent. First I'm going to gel my hands. Hi Ethel, I'm back. Are you alright if I proceed with getting the sample from your catheter?
Yes, okay.
Okay, this won't take long and it won't hurt, okay? I've covered you up and the curtains are all closed so no one will disturb us, okay? So I've gelled my hands, I've let them air dry. I'm now going to put my gloves on. Before I do anything else, I'm going to put an Inco pad, if one's available, underneath my port, okay? To make sure that if there are any spills during the procedure, it won't harm Ethel's sheet. I'm also going to apply some clamps distal to the port. So between the port and the bag, I'll apply them. And examiner, I'm going to pretend that 5 minutes has elapsed and I've got good flow into my ports where I can obtain the sample. Because I've touched the patient and I've touched the equipment, I'm now going to change my gloves. I'm going to apply some new hand gel, making sure my hands are really clean. It's really important in an OSCE to demonstrate very good infection control techniques and use PPE and hand gel frequently. So I get my fresh gloves on. And I'll start preparing my equipment. So I said before that for this procedure, we're not doing full sterile, we're doing ANTT Smart Site. So with this technique, we maintain the sterility of the Smart Site. So that's the Smart Site, the end of the syringe, where microbes can get in and harm the patient. Also the end of the needle and the port. The reason why we're using a needle is some ports have lock points of access, so you don't need a needle, but unfortunately this is one of the older catheters and they do come up in the OSCE where you do need a needle to access it to obtain urine. Okay? So before starting, I'm going to put my key parts together without touching them. So I'm going to open the end of my 10ml syringe. And I'm going to carefully open the end of my needle. This is my Smart Site. I'm going to connect it to my other Smart Site. And I'm going to leave them in the clean tray. Okay? Put my package down here. I'm going to get my 70% alcohol wipe. And I'm just going to clean the port now, okay? I'm going to support the catheter mount with one hand and clean for 30 seconds around the port, making sure I get rid of all the microbes. I'm then going to allow it to air dry after 30 seconds. Now I've got my needle. I'm going to aspirate 10 mils very carefully. Right, I've got my 10 mils, so I'm just going to drop the catheter onto the Inco pad underneath, okay? I'm now going to very carefully open the pot so you can see it. So I've unscrewed it, I'm not going to touch anything. I'm just going to put that into the pot, okay? So 10 mils of urine in the pot, and now I'm going to immediately dispose this into sharp spin. And put the lid on my pot, being very careful not to touch either the inside of the lid or the inside of the pot. And there's my sample safely obtained. put there. Put that on there. I'm now just going to pretend my gloves are damaged or they've got dirt on, as we always do in an OSCE. So I'm going to take them off. I'm going to gel my hands again because it's a point of hand hygiene when you take gloves off. Gel my hands again. And don a fresh pair of gloves. I'm now going to get my second alcohol wipe, open this, put the rubbish in the tray, and I'm just going to clean the ports. So any residue that might be on the port's gone. I'm going to clean for 30 seconds, air dry for 30 seconds, and while it's air drying I'm just going to remove the clamps. An examiner, I can see my urine is free flowing now and there's no obstruction in the catheter. So I'll remove my Inco pads, which I'll put into the bin. I'm going to take these clamps and clean them. All my non-sharp weights can go in the bin as well. I'll also remove my apron. And gel my hands. Hi Ethel, I've got the sample that I need. Are you okay?
Yes, thank you.
Well, you've all covered up now and your catheter's running really well. I'm going to give you a buzzer, okay? This is your call bell. If you need me for anything, just call, okay? I'm going to make sure that as soon as I get the results from your urine sample, that I tell you what they are, and if there's any bugs or bacteria or infection in the urine, I'll make sure you get the right treatment, okay? Are you comfortable?
Yes, thank you.
That's great, okay. Buzz me if you need me. I'm just going to document what I've done and I'll be around. I'll be back in half an hour to see how you're going, and I'll make sure you get a plenty big jug of water for yourself, okay? Okay, so that's the end of the clinical scale. That's all you'd have to do in an OSCE. I hope you're enjoying Ultimate OSCE, and if you want any more help or checklists, let me know. Okay, my details will be beneath on the in the comments box. Okay, bye.